Hello everyone, it's Dr. Sami and I'm here with an amazing guest, one of the best lecturer, one of our most passionate lecturer in Abia State University. I'm talking about Dr. Andy Ebere. Sir, can you please introduce yourself?
Okay, my name is Dr. Andy Berry. I'm an optometrist and also a lecturer at the Faculty of Optometry at Abia State University.
Okay, thank you very much. So before optometry, who are you? I would like to know where you're from and
Okay, um, I'm from Abia State. I'm from Obingo local government. I will say I'm someone who's passionate for teaching
mm,
and skill,
mm,
not just making sure that people have skills.
mm,
So I chose optometry because of my passion for medical skills and using medicine to solve and to bring life, to bring impact in lives. So that's why I choose optometry.
mm,
So, and that's been a wonderful journey. Before I became an optometrist, I was a teacher. Most
mm,
people don't know. I was started teaching in secondary school.
mm,
In my 600 level, on my sixth year, after our exams, I went to through.
mm,
I chose a school that doesn't have a science teacher, they don't have maths teacher, they don't have biology teacher. I taught there till I left the university.
mm.
That's how passionate I am. I would say I'm somebody who God gave the gift of teaching and I maximize it a lot.
If not optometry, what else would you have done?
Honestly, if not optometry, I'll just be a medical practitioner
Medical
in
practice.
a lab one. But I'll end up being, I'll add teaching to whatever I am. I just knew that I use the word, the outpatient department is where I was born.
Mm,
I was thinking I was also born in the classroom.
in the classroom.
So that's what the things I would have become.
That's it. How what, can you explain or talk to us about your days in university? How was it?
A blissful one, was a wonderful one, very beautiful. Um, because of our own time, we had fewer students and wonderful lecturers.
Mm.
We could have a lot of time one on one with our
Students and
students
lecturers.
and lecturers.
Mm.
So, and I had a very wonderful relationship with both students and lecturers. So in my senior level, I was the librarian.
Mm.
So I was like an extra staff of the department.
Mm.
So I knew every lecturer, I knew the department policy,
Mm.
I knew what the department expects from the students, from the university, and from NUC. Because my senior level, we did NUC accreditation.
Mm.
So that helps me a lot to properly understand my profession and to work closer with my students, with my fellow students, and as well as lecturer. It was a wonderful experience.
What you just said, students now find it difficult to develop that student-lecturer relationship. I would say one of the major because I'm just here as somebody who just left school and I know what it meant to be a student. I just left.
Yes.
So I know how they feel. I'm mostly going to ask questions based on
Yes.
a student
Yes. Yes.
from a student perspective.
Yes.
And I've also being a student, I also be around students, see what students talk about, gossip about lecturers, what
Yes.
things they say about lecturers.
Yes.
And that's one of the motivation
Yes.
why I want to be here. I want to hear from the lecturer's
Yes.
point of view.
Yes.
What do you think about the students? Why do you think students are now afraid to approach their lecturer?
Yes. It's a very complex answer.
Mm.
Then I will start. I personally, when I was employed
Mm.
after my youth service, during my youth service, university called me back.
Mm.
So they checked the student that I've graduated for a long time, where I get the shot. I was chosen.
Mm.
One thing I did the first I was employed was to get a personal projector.
Mm.
As in, I think I was the first lecturer to own one.
Mm.
As in, I own a personal projector just to make sure that I not just teach, I coach.
Mm.
Now, that's the first point.
Mm.
The lecturer must decide on his personal note to have that the difference between a coach and a teacher.
Mm.
A coach will have to have contacts,
Mm.
call you, how is it going, what's happening. So there's a personal decision on the part of the lecturer to want to have a relationship, a teacher student relationship with the student. Then on the student part, there must be a conscious effort to be open to such relationship. Now see where the complexity comes on. If a student plans to circumvent the system, a student, for example, the semester started, or they said that this course is very difficult, or this course will be hard to pass, they withdraw from the lecturer. On the lecturer's part now, let's become more interesting. Because of some relationship, some lecturers have experience from students. They tend to see, this is what these students have done before. Because of my closeness to these students, see the result I have this time. So there is a hasty generalization that this is how students behave. Because of students, they probably was a bit close to or had an association with some students abuse it. We are developing that healthy student lecturer relationship. Some students abuse it. Some students can match you and pass.
Yes.
They abuse it. So some lecturer will also withdraw. So just take it for granted. When we walk into the class, who will be that person self? Many teach come out here. I was in that mindset. So some students, some lecturer will not develop a persona of one, strong face person. Then there's a way to a lecturer can abuse it. There's a way you get too close to students. Your standing as a lecturer, your impression, this on your lecturer, your lecturer based on to. So there's a healthy relationship must be developed by a conscious decision of both parties, both the students and. So if the student does not follow the rules, no relationship. If lecturer does not follow the relationship, relationship. So some students who decided that this course, I now want to solve myself, and they decided from day one that on the exam day, somebody write the exam for me. From day one, decided that somebody write the exam for me. So there is no need of relationship again. They withdraw, and they see a lecturer who is following the rules. Generally, students they are not comfortable. They don't like comfortable. Follow the rules. They don't like too much. That's why over the years, I've developed a way to follow the rules and how to make sure they understand how to follow the rules. There's any way where the rules requires bending that can be approved. That's what I learned as my years. This is my 10th year as a lecturer.
You taught us something about people having this ideology that doctors don't have good writing and they do it purposely because they want to hide the prescription or the interpretation of the prescription from the patient. And you said you warned us about continuing with such narrative. We shouldn't push. We should write our prescription clearly. So why did you say that?
Yes,
in a country like our country.
Exactly. A prescription can kill a patient. A wrong prescription, wrongly prescribed, can kill a patient. A right prescription, wrongly interpreted, can also kill a patient. If a patient needs IM and you give IV, the patient can die. The patients need 2 hourly. The outcome is different when it's 4 hourly. By medical ethics, by medical procedures, the prescription is actually written not to the patient. It's to the pharmacist. It's the pharmacy that interprets it to the patient. So most times, most of us give patient prescription, they go home with it. It's actually that a paper you give to the pharmacist. So the pharmacist will see you are writing clearly, hiding it or For me, if you did a good job and you did a good job, patient will come back to you with their family. They don't care what you write down. Most times, growing up, most eye drops, they will remove, some clinics will remove the label and use tape to put it. Me, I will tell you the amount I'm selling my own. I will tell you, if you go to that pharmacy, see the amount. You decide. If you have a relationship with the patient will say, no, doc, because of you have developed a relationship with the patient. If you lose, you lose. If you gain, that's what I said. Following the rules sometimes might cost you, but just follow the rules and leave the consequences with God. That's what I learned my principle. Those who follow, what I mean rules. They are basic ethics. Basic ethics. Basic ethics is that a patient should know his or her prescription. If you don't, if it's not too close to the patient, or patient copies it or whatever, your prescription does not sum up who you are per se. There are more you can give. It's just one case. The patient wants to go and buy it outside, fine. But there's some patient will say, oh, God, madam, this drug, no buy them again unless somebody prescribes it. But if your patient trusts you, a doc, the patient will come back to you 100 times. Doc, because where will I tell you where will I even buy it? So if we don't have it, they will not buy anywhere. It's trust. If patient don't trust you, they will now, want to bypass. So write it clearly for your own security. Clearly, they will say you are the one that wrote it. And if you write anything ambiguous means that it can be interpreted two ways. Your license might be withdrawn. You say, oh, doc, why do you write this in two different ways? The better use clear for the safety of your own patient.
So rounding off now, I would like to talk about eye plus opticals.
Okay.
And you say something, it's not just an eye care.
Yes.
So I would like you to talk about it.
Yes. This vision started from my mentor. I was mentored by a great woman, Dr. Omoehu. As far back as 2004, 2006, 2007. She has been mentoring me. I was in my either 400 during ASU strike. I always go there. That's where that vision came. She opened my eye. That's how I wish you had mentioned earlier about mentorship. That's why I have passion in this kind of interview to the student. Without mentorship, there's no future for optometry because I was mentored by a distinguished optometrist. So that's where that vision came, and I tapped into it. Not just because other person how to teach us when we are students. The eye is not outside the body. The eye is in a human. So the eye must be treated with respect. That's bad enough more than eye care, more than just eye care. A woman who has glaucoma is also a mother. We must factor in her functional duties as a mother in fixing her challenges. And that is when my mentor tapped that vision and I tapped it. We go beyond eye care. When I mean eye care, not just giving prescription, okay, can go. No, we follow up. If there's any problem, we want to know what the problem is. If you give medication, we follow up. It's not just do sharp. Let me do sharp and go. No, we make sure we are detailed. There is detailed procedures are followed. If we have 10 patients in a day, let 10 be 10. Not 50 patients, yet not one was detailed, properly done. Our ethics, at one point my mentor said, the ethics of the profession are fully followed to the highest level. That's when more than just eye care. After doing the functional one, you must follow the rules, the ethics of the profession. We have ethics, also have the jurisprudence of the profession. You follow it. The patient would not know you are human. Some patients are also far from doctors. They're not too close. But when you after making a diagnosis, some doctors just prescribe, you go. They don't explain the diagnosis to the patient one on one. I'll end this story. I had a patient who suddenly stopped using glaucoma medication. Ask him why. He said, for years I've been using this eye drop, and they say my eye is not getting better. Instead, my eye is getting worse. You know why? The doctor who made the first diagnosis, I'm a patient with drug for 20 years. He said, no problem. It's most likely I can predict accurately. I might be wrong. That the day the machine was given, there was a clear warning, not warning per se, a clear knowledge to the pass to the patient. The drug I'm giving you will not bring back the vision you have lost. Copying can be reversed. A patient that has a copying of 0.7, 0.8, it can't reverse copying. As of today, stem cells is still in the lab. So the medication, if you're giving Timolol, giving Laptonopros, giving Brimonidine, giving Afagan, giving the biggest of the drug, your medication will not bring back vision. So on the first day you are giving a patient with advanced glaucoma medication, you must tell the patient. You don't tell the patient that, the patient will go home thinking that the medication will make him see better. That's what I mean by more than just eye care. And that should be the policy of every optometrist worldwide.
Thank you very much, sir. Okay, you are talking about the future of optometry.
Yes, the future of optometry is huge, is beautiful. With AI, for example, a time will come that an AI tool can perform a refraction. An AI tool, if you give the data, it will give you diagnosis. But my challenge is that if you don't have the fundamental skill, you know when the AI is misleading you. So we might have a feature of wrong diagnosis if the fundamentals are not learned now, are not instilled now. I'll give you a story. In the book I read, the two optometrists were discussing, this my part is not moving again. No. One person now joke, that's a laughing joke. Go and buy auto-ref. Buy auto-ref. And sorry, go and tell your neighbor, your colleague to buy auto-ref. I mean, somebody whose office is close to you to buy auto-ref, so that if the person is only auto-ref for a fraction, all the patient of that your colleague or that your neighbor will disappear. They will come to you. What was the message there? The message was that somebody who is relying on auto-ref results alone to determine a patient's prescription will have many wrong outcomes. Patient will come back dissatisfied from their lenses. Auto refraction, I'm just using one instrument, for example. An auto refraction, the result will give a more minus prescription. Poor understanding of astigmatism will cost you your practice. If I have 10 patients in a week, about 6 have been misdiagnosed of astigmatism. And mainly if the axes are oblique. Not everybody will have a sphere. I'm just speaking as a young optometrist. Let this go into our colleagues. I have patients who have done brain scan because of asthenopia, headache, temporal headache. They've gone to optometrists, but they couldn't see that axis. It was 120 in one eye, 60 in the other eye. Let's say problem minus 050 in one eye, axis 30, problem minus 050 in the second eye, axis 150. But please diagnose. Many people do not see it. What you see is -1, -2 as the prescription. Or if they give at all, they will give a regular what we call symmetric astigmatism. 180, 180, 90, 90. But nobody saw that this thing. Are you with me now? Patients now started treating typhoid, not knowing that axis. I've met more than 100 patients in my practice, and it's still counting.
Do you think examination is a true test of knowledge, sir?
It depends on the examiner. The kind of questions you ask. Some examiner will ask questions that are not relevant. So examiner can ask the questions that are relevant. Worldwide now, there is what called competency-based examinations. Not this write short notes on myopia. Somebody who studied accounting can write short note on myopia. If somebody who have been an accountant, who have been a myope for 20 years, can write short note on myopia. But for optometrists, that question is not a test of myopia.
Mm.
I get my point now.
Yes, sir.
That is um, the difference
Mm.
between a test. So it depends on the examiner and the question the examiner is requesting to be asked and from the student.
Mm.
So generally, some one of the students' examination was not the test of knowledge.
Mm.
Just, I can just remember one or two that would test. For example, now in a workshop,
Mm.
in a mechanic workshop, they don't do examination, or a hairdresser or a tailor. They don't do examination. We are learning as an apprentice. They don't do examination. Your true test of knowledge, the examination your boss will give you one day, your guy will give you one day, is that go and make that lady's hair, go and fix the tire,
Mm.
change this gearbox.
Mm.
They've been learning for years. That's examination. That's examination.
Mm.
But in the university, the examination is, they can ask you what is the optical principle of retinoscope. I was now it's different from perform retinoscope on this patient. If you perform retinoscopy on a patient like that or a myope, what are the things you see? It's different from write short note on retinoscope. Write short on retinoscope is not a test of true knowledge.
Yes.
But if I give you a clinical case scenario and ask a question on that issue.
Okay. With that being said, I would like to ask, because during your days in school, did you ever fail any course? Do you have a carryover or something?
That's a question that is one of my biggest encouragement to students who are struggling. Because students think carryovers are normal, they begin to have fear. How many carryovers do you have this semester? So I'm happy you asked that question. I never had. So are so many students. They never had. They didn't know the meaning of carryover.
Yes.
The lecturer comes to class, you find the lecturer's requirements. If the lecturer requires cramming, we make sure we give the person the cramming. We sure requires this. So the not I've tried my best. I've done the required for each course. If you do that, you don't have any carryover.
Okay.
I'm not saying that some lecturers. I'm very serious. Are monsters who decide that they want to fail. This boy didn't greet me well. They are humans. They say, I want to fail you. You have had so many cases like that. This lady is not agreeing to sleep with me. They want to fail you. But the university also have way to remedy such. But students are also scared of following that remedy. But generally, it's a thing of grace as well. I don't have any carryover. Not because I was too good in it, because I just followed
The
principle, which is what is the course require? One, what does the lecturer require? Whatever it is, I will pay the price. But the price is what is legal requirement, the policy requirement. If you say give me money, I won't give you money. But if I fail the course, I know what to do. The university has what to do. I've never failed any single course as a student.
Some our students now can argue that back then that they had students that passed with D and E's.
Yes.
And now they are pushing them to get a 50, which
Yes.
is a C
Yes.
for you to pass.
Yes.
What do you have to say about that?
Very good question. If you study carefully, most of our results, anybody, most F's will have. Apart from few lecturers, which you don't know. Some students F are usually 39. It means that lecturers push students from 40. I can remember Professor Ameti's courses, Dr. Andy's courses, Dr. Jesus courses, Dr. Ezebo's courses, even Dr. Maka's courses. There's a few I can call. Professor Hammer's courses, Dr. Christimo's courses particularly. So Dr. Christimo's moves students. I'm saying in public that students will know. It's good that this know information. No, and the information can be verified.
Yes.
But from the hard copies.
Hard copies.
I read Dr. Christimo's. Sometimes Dr. Christimo's will move students from 35.
Another thing I'd like to ask is that
Yes.
you are one of the. I can remember you figuring out how people copy students. You know everybody by their writing, and when somebody is writing for somebody,
Yes.
it's easier for you to dictate. I don't know how you do that.
Okay.
So it's assumed that some people will say, nah, Dr. Andy get time. Like, how was he
Yes.
able to figure out that this person copied
Yes.
from this person?
Yes.
How do you do that, sir?
Like I said earlier,
Mm,
understanding your students, knowing them,
mm,
mm, will make them better students.
mm,
And two, apart from that,
mm,
I believe strongly that optometry is a skill.
mm,
It's a skill, as in like a hairdresser.
mm,
Some ladies choose their hairdressers. They know if that hairdresser is not around, they don't go there.
mm,
And because of that, I train my students one on one. So I know them one on one.
mm,
I know their weaknesses and their strength to make them better.
mm,
If such students does not come to an exam,
mm,
I've been mentoring you. I know your handwriting. I'm mentoring you.
mm,
If you are somebody who is struggling, I know the struggling ones. I know the bright ones. I know the ones that will need more push.
mm,
So if there's any reason, the person that I've been helping to push, then the handwriting changes. Because I know the person.
mm,
For example, now, if a coach is not even seeing where he sees only legs of players, the coach will know who passed that ball.
mm,
Not that the coach didn't see the face.
mm,
The coach will know because of they've been training session with them.
mm,
I wish one of them have training session for the football match. We that are watching, we are watching the football match, but they spend more time on the training field.
mm,
So that's why on the training field, I know the examination is just it's an event.
mm. Okay, so what do you think with the modern teaching,
Yes.
modern system of teaching,
Yes.
and the invention of AI? You find out that students use AI to write exam now. What do you think about the invention of AI?
I think AI has been a blessing to 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 the whole world.
Mm,
So wonderful. I was teaching the students how to even use AI. So it should be part of our teaching. I teach how to even use AI now. They were shocked that what AI can do. They were even shocked. They were looking at me aghast. AI is a blessing, but it's sad that it's used negatively. Our own time, we had only library. Only library. And that time said we go and hide the text. We're not much. And that time internet was just coming in. So we don't have big phone like that. If you have big phone, maybe your parents were wealthy. You can afford the phone that can browse. So 80% we were using Nokia Touch. Or that time we had Samsung called the Blueface. So we had few people who had phones that can browse. So AI is a beautiful thing, very beautiful, if used positively.
So having said that, who is an optometrist?
An optometrist is an eye care provider whose primary duty is to provide comprehensive eye care to patients that present to him or her. The scope of practice of what I just said now is determined from country to country. But worldwide, there has been a peak in the scope of eye practice of optometric worldwide. Big impact, big one. And in our country, I'll start from Nigeria, our scope of practice includes primary care optometry. And this primary care is huge. We are permitted to treat all ocular diseases that present to our clinics. We are permitted to use optical devices to restore poor vision or to bring about vision related problems. We are not permitted in any way to do surgeries in any way at all. So that's our scope. But anything eye care, the law permits us to do it except surgical procedures. In the future, who knows? Might be allowed to do
Surgery.
minor surgeries
Mm.
under supervision of another eye care experts.
Okay.
But for now, even our scope is huge enough. It's huge enough.
Mm.
Very huge. Vision training, low vision, rehabilitative optometry, cornea and contact lens. Our scope is huge. The non-surgical part of eye care is huge. In most general hospitals worldwide, in most teaching hospitals in Nigeria, particularly, we don't do surgeries every day. Not even do surgeries. So some selected things we choose to do surgeries. It means that the non-surgical cases are huge. And when you see non-surgical cases, you will not isolate those who need surgeries. The expert in that area will administer surgeries to such patients. So that's our scope. It's huge. It's very huge. So even though that it's not surgical, we still have specialty areas in optometry. My point, we have specialty areas in optometry. That's how we have pediatric optometry. We have cornea and contact lens. We have low vision. We have ocular health. We have rehabilitative optometry. The sub scope are also huge. Primary care optometry is so huge. Ocular health optometry is so huge. An expert on cornea, an optometrist who is an expert on cornea, his or her cases is in their millions. I just pick on you that area.
Yeah.
An expert on primary care optometry, his or her patient is in millions a year.
So, having said that, do you think we have enough optometrists on ground to handle the number of population we have? We have about 200 million people in Nigeria.
The remission of optometrists, let me not speak of it's general, even doctors. It's general. So most people, students, will say, what's Dr. Ndebisi doing here? Is Dr. Ndebisi here? So what's surprised?
What are you still doing?
So it must be crazy, unquote, to remain in system of system. It must be mission driven. When I mean mission driven, it must have a purpose in life. My personal mission is to have as much as I can. I will instill that
Knowledge.
Not just knowledge now, skill, automatic skill. Even though we are producing, they are seeing we know. As of fellow students, those graduated, they know. Many of them graduated, they left, when they come to skill, they left empty. They just wanted to graduate. So that is my mission, to make sure that as many students, I started something 3 years ago. I think those who started with 18 or 17, then something magic number students. I started something with them. At the end of every session, I told my colleagues at lecture, I told them, let's do something unique to these students. A week, only skills, no lecture. Lecturer skill. Lecturer skill. That's my mission. And I will tell you that I'm tired of lectures. The world is not moving towards lectures again. The world is now moving towards what can you do?
Your results.
No results on paper.
Yes.
This is a patient that has glaucoma. What must you do to make if a patient tell me today, I can no longer eat. I see my food I'm eating. That hurts me so much as a doctor. I can't see my food again. A patient once told me recently, my child's assignment, I can't do it again. That is painful. But if that patient had access to quality eye care, that situation would have been averted.
I must tell you, there was a time in school I helped you packing books and I told you that I love you.
Thank
and
you.
You said, all fake love. So I want to tell you again that I love you, sir. I love what you do and I'm honored to have you on my space.
Thank
you very much.
God bless you.